Welcome to Caregiver Cast with Mary Elaine. Are you overwhelmed raising a family, working full-time, caring for a parent or grandparent? It can be challenging when you're doing it alone. Caregiver Cast helps busy, burned-out professionals reduce their stress and overwhelm to create a better caregiving experience for themselves and their loved one. Caregiver Cast brings caregivers together with experts who provide information in a variety of areas. In each episode, you'll get tips on topics such as finance, legal, medical, self-care, community resources, mindset, and more. We're here to make your caregiving journey a more rewarding one. Acquire the confidence and skills to be a more capable caregiver by implementing the resources and strategies from these expert thought leaders. Get a community of support, resources, and strategies for your caregiving journey inside the Caregiver Lifeline community. Visit caregiverlifelinecommunity.com. And now here's your host, Mary Elaine.
Hi, I'm Mary Elaine. I'm your host for Caregiver Cast. My special guest today is Jennifer Woodruff, and she will be talking to us about empowering health consumers, navigating healthcare with confidence and compassion. Before I formally introduce Jennifer, I'm going to just give you some background information about her. Jennifer is the founder of the Patient Better Project, Inc., which is dedicated to empowering patients and caregivers to take charge of their healthcare journey. With a strong commitment to education, Jennifer has led the creation of a program that equips individuals with the skills to navigate the healthcare system and advocate for their health needs. Welcome, Jennifer, to Caregiver Cast.
Hello, Mary Elaine.
I'm so glad you're here because this is definitely a topic that caregivers need to know about. Could you please share the inspiration behind establishing the Patient Better Project and its mission to promote health advocacy?
Absolutely. So it began a long time ago, a couple decades ago. I became a sales representative for a drug and device companies and stuff like that. And one of the things was that I had to educate patients. I realized that when I was, educating patients about whether it was a post-surgical device or, a medication that you take or whatever the case is, throughout their healthcare journey, me, along with the other health professionals, were giving patients a step-by-step program or education about what to do, what's your next step, how to do this. And then we would also, back in those days, we were able to look in their medical chart, kind of navigate and see where they were. And then we can tell them better at the next step and how to move along. This was before electronic health records came into mandatory. And during my interview, and as I was talking, I would, let's say if we had somebody that was going through a total knee surgery or something, a total knee replacement, and they're going through the surgical process, there was times where they would have to, get ready and prepared for the surgery. The surgery would happen, and then, it's the rehabilitation and everything's going back to health. So I was often at the end of that line, with devices and working with, physical therapists and maybe a home health person or rehabilitation centers. It just depends on the patient. But anyway, so as I was talking to them, I realized that we were always giving the same information to the patients. Well, because, this is what I do and this is what I do. So when 2018 came along, I had the opportunity to start writing and kind of brainstorming with, my own thoughts. And I brought together this book that really just taught people how to work through, and then so forth and so on. It became an actual program, and through my research and development, we just became and exploded into the program that it is today.
That's really amazing that you have taken your work experience into this new journey in this nonprofit and profit organizations that you now have established. So explain to our audience, how does your nonprofit assist health consumers and caregivers in managing healthcare more effectively?
Certainly. So, like we were talking about just a little bit before we started recording, it's not really what you know as a provider or as a consumer or a caregiver. It's not what you know about your medication. It's not what you know about your chronic condition. It's not about your illness. What it is your activities. This is the most important thing. So when people come in and they want to work with you as a patient or a caregiver, really, there are certain activities that are expected of you, especially after COVID, and now the electronic health record has, infiltrated pretty much every practice here in the United States. And so there's a lot of activities that are going on as as a patient that you're expected to do. And if you perform those activities, just like in activities of daily living, there's certain activities that patients are now expected to do, like retrieve old medical records, bring a notebook with them, understand acronyms, and be able to just identify basic, medical terminology, and fill out their intake paperwork. These important activities are expected on patients right now, especially with the healthcare system being as strained as it is. And what has been going on is that people are now relying on the electronic record to hold their information, and that is not it. People have got to take their healthcare into their own hands, especially the way the movement is going on with the healthcare facilities. Hospitals are rebuilding. Clinicians are leaving. Hospital systems are changing, and they're updating themselves. The person that is going to take care of your health, who is responsible of your health, is you. And that's the only person. And so what I did with this nonprofit is I wanted to reach the entire population, if you will, all the Americans. And what I wanted to do was supply them so they can all live in this new healthcare system environment on their own.
Well, I think that's really critical for anyone who is listening, because physicians only have about 10 or 15 minutes that they can spend with you. So the more time that you're prepared to go into your doctor's visit, the more information that you will glean, and the provider can give you more information about your next steps in your health journey. So thank you for that. Can you tell us more about the 20 activities that make people engaged in care and how they contribute to better healthcare experiences?
Absolutely. So the thing about it is I kind of mentioned it in my last answer, was about the 20 activities. Again, it's bring your notebook with you, fill out your intake paperwork, understand how to be able to retrieve an old medical record if you can, be able to access your patient portal and have to do multiple portals if needed, because a lot of people have more than one chronic condition. They have, each specialist going in, so you have a dynamic. Showing up on time, being able to answer routine questions and asking the appropriate questions the right way. A lot of times, if you do bring your own notebook, I completely understand. Well, what would you possibly write in it? There's activities that need to be done. We teach you through our webinars, our micro lessons, and our micro videos, and we teach you step by step how to do this. And it's a little bit, but it's a standard. That way, when a practitioner and you have your patient better medical record management health advocacy program with you, the doctor will be able to see this program. And because it teaches you the inside of what's going on in the medical practice, You have a full understanding. So when you're going in there, you're bringing your notebook, you know what kind of notes to write, know what kind of what questions to answer, and know how to ask the appropriate and respectful questions that is not going to take up too much time, but it's going to give you that information-driven appointment. So when you go home, you will have that list. You will be able to maintain, from this for the 6 weeks to 3 months to maybe even a year. You will be able to sustain longer your health care and understand it, work with your insurance and stuff like that. And I also wanted to be clear, the 20 activities is not, and I know a lot of people are thinking about that. What we do is we focus on the administrative side. So we don't really work with any of the conditions. We work with all conditions, of course. But we show you the administrative duties that align with your condition.
Okay.
Meaning that not eating, we don't touch about eating right, or doing your sit-ups, or drinking healthy lemon water or anything like that. What we talk to you about is how to read your insurance. Why did your insurance deny you on a previously approved and then later denied claim? How to fight a claim, how to be able to save money. And I'm in my mind, I know that we had the questions and everything, but we did have that little powwow session prior to this recording. So I'm not sure what I said earlier or, couple in. But with that being said, with the 20 activities and how we make this possible, it's just these little activities. But when you're able to manage your medical records and you're putting that into place, you're taking care of that yourself. Your 20 activities are coupled in with that.
So explain how your 20 activities are interwoven with the rest of your program and how that improves your healthcare experience.
So there's some things that health consumers need to be enlightened on. Going into the doctor's office, it seems very, very simple. And I've got a lot of articles that kind of touch on different subjects and stuff like that to help people along the way. There's a couple of things that when a patient becomes a health advocate, they are aware of that they normally wouldn't be aware of just by performing these 20 activities. It is true. And one of the things is that getting ready for their medical appointment and like their scheduling. And I know that it seems like, hey, the schedule is here. They're asking me to come in. I'm making these appointments. I know that I'm supposed to be every 3 to 6 months and all this other stuff. And these are done electronically. But what really is behind the scheduling system and stuff like that? And a lot of times they don't tell you everything that needs to be done when it comes to scheduling. And they make it a lot more simpler than it really is. And that's how they make their money, basically. And that's what the article touches on. And you begin to realize that when you open up and you start being the health advocate for your health, you begin to realize some things like that you are going to be more in control of. And one of those things is making your own schedule. I'm not saying that, hey, it's only 6 p.m. can I come in and see the doctor or whatever the case is. But I'm saying when it comes to your own schedule, being able to listen to that electronic health record, bugging you and saying, hey, it's time for a schedule. But you end up at the end of the day, if you're just a patient and you're kind of going in blindly and allowing everybody to take the reins and you're relying on that electronic health record, when you're not getting the appointment and you're not getting the information that's truly going to make you healthy. When you become a health advocate and you've completed these 23 micro courses, you begin to open your eyes up because you are more in control of your health than you've ever been. So your eyes are open. So you're not, relying on the electronic health record. You're listening to yourself. You're making those schedules on your time as an advocate because you are very aware of the paperwork that you're doing. You're reading, you're understanding it more, and being able to, take control. And I think that's one of the biggest things, because going in, being blind into an appointment, not understanding fully why you're there, not being able to, recite a chief complaint, and a chief complaint is why you are there. So when, and it's of quality and it's meaningful and it has substance, your provider is going to give you more quality, meaningful, valuable information to bring home with you. And that way, these medical appointments that you're spending your time, you're getting, you're going, taking the drive, getting off of work, doing whatever you need to do, separating yourself from your family to make these appointments, and you're really not getting the information. It is a huge strain on our healthcare system, and it's a strain on you too. That doesn't necessarily have to be there. So with the health advocacy learning, these 20 activities, you will be able to be more in charge of your health. It's incredibly important because these 80 million Americans that we were talking about that are unwittingly suffering from healthcare illiteracy are actually spending about $7,000 a year additionally. And I'm just saying about these 4 things: medications misuse, rehospitalizations, longer hospital stays, and unnecessary trips to the emergency room. Just out of those 4 things, we're not talking about having to get extra caregivers. We're not talking about, making that, the gas trip, the time off of work. We're not talking about all those, those additional costs. We're just talking about those 4. And with that being said, when you end up in an emergency room for medication misuse, or you end up unnecessarily there and having that day where you could have just been at home and probably have taken care of it via telemedicine, you begin to realize, and you're, if you're taking your mom or whatever for a UTI, if, she's got dementia or Alzheimer's or something, scary like that, and how it would be preventable, the next thing you're going to say is, oh, I can be a health advocate, right? I would do anything to avoid that. That $7,000 a year pales in comparison to all of the horribleness that goes along with a longer hospital stay, a rehospitalization, medication misuse, and thus an unnecessary trip to the emergency room. Those are scary and real things. And if you can prevent that and make your health better, it pales in comparison just by performing these little activities.
Wow, that's pretty enlightening and scary that you're spending $7,000 more in a year in healthcare by visiting the ER. I can attest that I've been through the ER for some major events. So I can see if you can avoid it at all costs. It makes much more sense because you could obviously use that money in different ways to have a more productive, healthier life where you don't have to go through all of this possibly unnecessary medical treatment if you just were advocating for yourself before that event occurs. So thank you for that. As a nonprofit, a 503c3, how do you envision creating a positive impact while maintaining financial sustainability? I know this is always a tricky question with nonprofits.
Sure. Yeah. So, it's just not like it used to be when it comes to healthcare and software and stuff like that. When it comes to grants as well. And, I'm no different than any other nonprofit. I opened up in 21. But the thing about it is that I already had this program. This year was opened up in 2019, or it was created in 2019. By the time it came to this actual program, I just took my for-profit and said, okay, we're going to make this nonprofit happen. And my nonprofit is done through my love and my previous, well, it's not my previous company, but my other company now is fueling all of that information into this nonprofit. And the reason why I created the nonprofit is because I needed to extend my reach. I could not sit back and say, okay, well, anybody that had, a couple $100 to spare on a health advocacy program, okay, great. But we needed to reduce that price. We needed to get it down to the bare minimum. So that way, if you're on Medicare or whatever the case is, we talked about this briefly, but let's wipe that off. Let me get you your program. Let me make sure that you're safe. You're safeguarding yourself from these 4 things. Medication misuse and, unnecessary trips to the emergency room. Let's make sure and safeguard you and protect you. And do these, like I said, micro courses. Very simple, very easy to do. You can do it on a Saturday afternoon, and this will last you for the rest of your life. You share it with your family, you share it with your adult kids, you share it with your long distance relatives that are taking care of your finance, your health finances away and putting your community together. It's not just you, it's your entire, community that's taking care of you. So my nonprofit, what I saw was, hey, my reach can be extended to rural parts, to the, basic everyday people that we're looking for, and like we were talking about, getting in touch with the caregivers and holding on to them. They're busy. They've got a lot of, and they're sick on top of it. So life is not already hard for everybody, but on top of it, you're sick. This nonprofit is there specifically for these folks, and to make sure that it's in your hands. And so that way, if you can't get it, I'm getting it to you.
Okay.
So that's the important thing. And I don't want to let something as simple as money get in the way of you improving your life or your health. And illness happens to everybody. And let's not segregate that. You want to have an independent program for everybody.
Wow. I love your passion and your vision to have this program available to everyone. And I truly appreciate that, because I know sometimes people need additional resources such as what you're offering, so that they can have like all the information, or ask for the information that they need, so they can avoid uncostly medication errors, trips to the ER, and the other possibilities that you mentioned.
And also that is the heart of my program. I make health advocacy accessible. That is right there on my website. It's on the upper left-hand side. I make it accessible. So if you or anybody that's listening to this podcast and they say, man, I just don't know if I could do all this. I've got a lot of things that are going on right now. I make it accessible. If you are able to fill out if you're able to fill out your doctor's paperwork, there is no reason why you can't complete this program. I'm here to help.
Thank you so much for that. I really highly recommend that everyone listening to this podcast talk with Jennifer if you can, so that you can get the information that you need, so you can be a health advocate for yourself and others.
Or email me, go into my website. My email is info@patientbetter.com. Email me. Let's start a conversation. Let's get this going. Let's get this in your hands.
Most definitely. Thank you. You also indicated that you have a free offer for everyone in our audience. Could you please let us know what that is, Jennifer?
Yes. So here's my 80 million Americans unwittingly suffer from healthcare. What does that mean? People don't realize that they're healthcare illiterate. So what we did is we created a healthcare proficiency challenge. And what this is just a kind of eye opener. Let's see. Let's put your money where your mouth is. And if you believe that you are truly a health advocate, and you've taken care and you're the doctor's dream, let's see what you do. And fill out that self-assessment and really find out where you stand in today's medical marketplace. So that's what I got for you guys. So you guys can at least we'll be getting the ball getting the ball rolling, and let's tackle this together. And let's see where we stand. And that's going to be our first thing. And then let's go from there.
Wow. Yes, I really want to encourage everyone to go to Jennifer's website for the Health Proficiency Challenge. This will really empower you to assess your health management skills and how you can become more engaged as a patient. So Jennifer, again, please tell us your nonprofit name and how to get access to you.
Very good. So my nonprofit is the Patient Better Project. My website is patientbetter.com, which is PATIENTBETTER, patientbetter.com. Go ahead and look at that. You're going to see the phone number, the email address, everything that you need to do get a hold of me. Also, I have social media, YouTube, Facebook, Twitter, and LinkedIn, all under Patient Better. Just look for me there under Jennifer Woodruff too as well. If you can't, but you will be able to find Patient Better. We've got it all written down. Read the articles, get yourself going, get yourself to be a health advocate. If it's not right for you today, well, if you ask me, it's right for everybody. But if it's not right for you today, at least go in there, look at my articles, read my articles, watch my videos that I have on YouTube, like and subscribe, and just keep the conversation with me going. So that way, when it comes time to it, you'll be able to take care of it, take care of your health on your own, be in more control, live independently longer. There's absolutely no downside to being a health advocate in your health. No downside.
Okay, I think you said it all, Jennifer. There is no excuse for not being your own health advocate. Thank you so much for being here, for your offer, and really encouraging people to complete those 20 activities so that they can start getting the information that they need and want so they can have a better life without having to spend extra money on unwanted ER visits. So thank you so much for being here today. Yes.
Thank you so much, Mary Elaine. I greatly appreciate your time, and thank you so much. Great to get to know you and your followers, and hopefully we will have a long-term relationship, and we'll see what we can do with health advocacy, caregiving, and making this world a better place for everybody.
Thank you so much. That I think you've said it all. So I think I will end there. Thank you very much for being there.
Thank you for listening to the Caregiver Cast today. Get a community of support, resources, and strategies for your caregiving journey inside the Caregiver Lifeline community. Visit caregiverlifelinecommunity.com. Get involved with the show. Send your email to mpetrucci2002@gmail.com. And we'll see you again next week for another episode of Caregiver Cast.